All right. My name is Justin. We're going to be demonstrating the EREMT trauma assessment skill sheet today. So this is going to be my patient. Her name is Lisa. So the first 4 steps that we're always going to consider in any trauma assessment is going to be our scene safety. That's pretty basic. Is the scene safe? Are there any hazards available? Is this going to be an assault, a shooting, dog bite? Look around. Is there electricity? Are there any hazards that you need to be aware of or stage for PD for? We're going to want to know our number of patients. We're going to want to know our mechanism of injury, and we're also going to want to know if we need any additional resources. Are we going to need extrication, hazmat? Are we going to need more than 1 unit? We need to get those started as soon as possible. If we approach the patient, we're going to want to make sure that we have all of our bodily substance isolation intact: gloves, masks, gown, eye protection, whatever is necessary for the scene. A minimum of gloves, more likely than not. As we approach the patient, the first thing we're going to want to do from a distance is our general impression. We're going to take a look at our patient. We're going to look at their age, their weight, what their general stature is. We're going to see, are they reacting to us? Do we notice any immediate life injuries here? When we look at them, are they looking at us? In this case, yes. We're going to want to take spinal precautions here if needed. Have somebody hold C-spine on them. Next, we're going to want to get a further assessment of our patient's orientation. Are they alert to verbal or pain, or are they just unresponsive? At this point, we're going to move on to our ABCs. First, we're going to look at our airway. Is our patient's airway patent? Do we see anything in the mouth, anything that's going to represent any signs of choking? Do we need to do a head tilt jaw thrust or anything like that maneuver? We're going to then check our patient's breathing. We're going to look at her chest. We're examining for equal rise and fall of the chest. We're going to see what their rate is, how good they're breathing. We can also take their lung sounds in all 4 fields. Then we can move on to our patient's circulation. Do they have a good pulse? Do they have a radial pulse? Do they have a carotid pulse? What's their skin look like? What's the condition of it? Is it pale, diaphoretic, warm, cool, normal? We're going to check their cap refill, see how long that takes. If it's delayed, we might start being more worried about things like that. Then, after we've checked the circulation, at this point, we will also be checking for any major hemorrhages and fixing those as needed. When we talk about major hemorrhages, we're talking about anything that's going to be a threat of life. So if they just have a small gash on their forehead, we're not necessarily worried about that at this point. But if they're bleeding extensively with an arterial bleed from the leg or the arm, we're going to be more concerned about that. We need to get that taken care of at this point. We can get them trauma naked and observe for more bleeding throughout the body. That may be necessary at this step. Then we're going to go to look at their responsiveness some more. We're going to see what their GCS score is, what their ABPU is, and at this point we're going to have to make a transport decision. And some patients, you're going to walk up and you're immediately have that transport decision made. If they're extremely critical and just obviously right off the bat, it's going to be a kind of rapid transport situation. But in any case, no matter what, after we've completed this primary assessment for ABCs, we're going to make that transport decision. Are we going to begin packaging our patient for transport, or are we going to stay around on the scene some longer, continue further assessment, further treatment? What's needed? After we've made that decision, we're going to move on to vitals. We get our blood pressure, our SpO2, our pulse rate, our respiratory rate. All those things can come in at this stage, and it's going to help us determine what comes next. After we get our vitals, or even while we're getting our vitals, we're also going to be working on a sample history. That may, in a lot of situations, you may not have time for that. If our patient is unresponsive, if none of the bystanders know anything about what's going on or our patient, we may not be able to get a good sample history. But if you do have somebody there, while the patient is being packaged and loaded onto the ambulance, this is your time to do it. Once you've got them loaded and they're unresponsive, you cannot get a sample history or any more information once you begin transporting. So make sure you know that before you begin moving on that ambulance. After we've got that, we're going to move on to our secondary assessment. This is going to be our detailed head-to-toe assessment. So head to toe, we're going to start at the head. We're going to examine the scalp, work our way down, look at our ears. Do we see any drainage from the ears? Check both sides, nostrils, mouth. Open the mouth, look inside of it. Do we have any bleeding there, any loose teeth, anything that's going to present a challenge or an airway compromise? We're going to look at the pupils. Are they pearl? We're going to move down to the neck, check for JVD, tracheal deviation. We can come down here, check out the spinal processes, palpate your neck. This whole time we're looking for tenderness. If they're saying anything hurts, if you touch somewhere and it's hurting them, take note of that. We'll move on down. At this point, I like to do the back. We'll go on down their back, palpate down there, take a look at it. If they're not trauma naked at this point, you're going to have to get them trauma naked. Take off their jacket, their shirt, take a look at what is there. Then we'll come down to their chest, palpate the sides of the chest, get those ribs, check for stability, come to the abdomen, check all 4 quadrants. Then we'll move to the hips, check the stability of the hips. After we've got that core done, we're going to move on to our extremities. So, take your time here, move down. Make sure you're checking for those deformities. Come down to the feet. Check for your CMS here. Do that with both legs. Once that's done, we can come here to the arms. We're going to do the same thing. Moving down the arms, checking for deformities, any signs of trauma. Get down, check for our CMS here. Make sure that's all intact. We'll do that with both sides. We'll check the buttocks, we'll check the groin. And at that point, we've got our secondary assessment complete. Any injuries there that we find that we need to treat at that point, we can treat. This is where we're going to do things like our splinting and stuff like that. That's not necessarily going to be maybe an immediate danger to our patient's life and limb, but it's something we can still treat. This is the stage we'll do it at. Do we need to start any IVs? Are there any other further assessment techniques we can use, such as like an EKG, glucometer? At that point, these are also going to come into play, and we're going to make sure we have those on hand, assessing the patient as needed. So at that point, you're going to have to make that, you made your transport decision, you're going to have to make your destination decision. Where are you taking this patient? Are they going to a level 1 facility? A level 2 facility? Can they go to a level 3 facility? Is something minor that just any sort of emergency room can handle? You're going to have to decide that now, if not earlier. And our critical fails are pretty simple. We're going to just want to make sure that we've dealt with all of our major life and limb, that we've treated our patient well, we've maintained a good affect, we've let them know what's going on, we haven't missed any major trauma, we haven't skipped around at all. Remember, the biggest thing is we want to do our ABCs before we get to our secondary assessment, because your ABCs are what's going to determine whether your patient immediately lives or dies. We need to treat those as soon as we can. We can't treat them until we assess them. So that's been the EREMT Trauma Skill Sheets Assessment. Hope you all enjoyed it.